Probiotics help to restore the natural balance of good bacteria in the intestinal tract. Probiotics can support digestive health and immune system function. They provide relief of occasional intestinal distress and minor gastrointestinal pain. They're appropriate for some people, but are not needed by everyone. For those who have taken antibiotics or other medications that can upset the natural balance of bacteria, taking a probiotic supplement is important. Of course, we want people to live healthfully and avoid the need for antibiotics. But if you've taken an antibiotic, then you should be on a probiotic for approximately 6 months. They're also sometimes helpful for people with autoimmune conditions, digestive issues like inflammatory bowel disease or irritable bowel syndrome, or constipation or diarrhea. In other words, if you have some digestive disorders or allergies or autoimmune conditions, then taking a probiotic is usually helpful and advisable. My new probiotic supplement, Probiotect, is unique in that it includes B. longum, a special strain of bacteria that soothes the digestive tract, prevents inflammation, and guards against digestive upset. It also contains S. boulardii, a beneficial probiotic yeast that supports normal bowel function and helps digestion. It has a significant supply of active cultures, 20 billion per capsule, and I used a special capsule designed to resist stomach acid to ensure the maximum number of viable cells is delivered to the intestines. Each capsule is individually sealed in a nitrogen purge blister pack to preserve freshness, so there's no need for refrigeration. Probiotect is a great probiotic for those who need it.